Hi, my name is Hasina Maradia, and I'm a PGY4 at Mayo Clinic. Thank you for the opportunity to present today. So derriere disease is a chronic disorder that can severely affect quality of life and be very difficult to control. Oral retinoids are considered standard therapy for derriere disease, but may provide insufficient control or be contraindicated. In this case series, we evaluated the utility of CO2 laser as a treatment modality for derriere disease. This case series includes patients with derriere disease treated with CO2 laser at Mayo Clinic in Rochester. Specific settings varied by treatment. In most cases, a 125 millimeter lens was used in continuous wave mode in defocused fashion, with power ranging from 10 to 60 watts and passes between 1 to 4. One patient was treated with fractionated laser initially, then with ablative laser. All others were treated with ablative laser. We had a total of 12 patients in this case series, among whom a total of 20 treatments were performed. The average age of patients was 47 years. There was an even split in sex of patients. The average body surface area covered per treatment was 320 square centimeters, but there was a wide range between 18 to 1,500. A total of 9 patients were previously or currently on an oral retinoid at time of laser treatment, and 3 on a topical. The most common areas treated were extremities, buttocks, and trunk, followed by face and intertriginous areas. In terms of outcomes, for the one treatment with fractionated laser, there was no scar formation with the treatment, and the patient did have recurrence in the treated area. However, he had no recurrence after switching to ablative laser with a degree of scar formation. Among the 19 treatments with ablative laser, there was no recurrence in treated areas. The adverse effects were scars for all cases, pain, and prolonged wound healing. These were cited as reasons for deferring additional treatments to other affected areas by a total of 4 patients. In our first example case, we have a series of images to show the healing course. Here, the patient was treated with ablative CO2 laser on the upper back in the circled area. The area is shown immediately after treatment with the endpoint of firm yellow to white appearance in the dermis. Here is the healing after 4 months, and on the right, the appearance when the patient followed up 5 years later. At that 5-year follow-up, the areas that were not treated did have active disease, as shown on the left, while there was no activity in the treated area, though there was a notable scar that remained. The same patient also had treatment of her left temple in the circled area. At 5-year follow-up, there was a scar in the treated area with no active disease there. In contrast, on the right temple where she was not treated, she had persistent disease activity. This is the second case. The patient had treatment to the lower back. He had no recurrence within the treated area, but did have new activity in the peripheral rim of the treated area, which is actually a known phenomenon after ablative treatment. Of note, this patient was on isotretinoin. In this third case, the circled area on the ear was treated. He had clearance in the treated area at 8-month follow-up, but active disease in the periphery. This patient was on acitretin. In this fourth case, the patient had treatment only to the left popliteal area. We actually have 15-year follow-up for him. He had a scar in the treated area without any recurrence within it. He had mild involvement in the untreated area. In conclusion, CO2 lasers can lead to long-lasting, if not permanent, improvement of areas involved by derriere disease, and thereby can improve quality of life for patients. The efficacy appears to be linked to formation of a scar after which recurrence was not seen, but unfortunately, this is a major limitation, especially in cosmetically sensitive areas. Lastly, our case series demonstrates the important role that lasers can have in managing certain complex dermatologic conditions like derriere disease. Thank you, and thank you all for being here.